All right, welcome to another deep dive, everyone. Today, we're taking a close look at a system that's, well, let's just say it's pretty crucial to keeping things running smoothly in your body.
Absolutely.
The genitourinary system.
You got it.
Otherwise known as the GU system.
Yeah, that's the one.
Think of it like your body's built-in waste management and water regulation department.
Precisely.
Pretty important stuff. And we've got this really in-depth chapter here that lays out all the nuts and bolts, from how it's all plumbed together to what can throw things off and how medical pros step in to fix things.
Right.
So our mission, if you will, for this deep dive is to pull out the most interesting need-to-know stuff about the GU system from this chapter.
Yeah, make it clear.
Yeah, exactly. Make it clear, make it fun.
And relevant.
Totally. So you walk away with a good grasp of how the system works and what can go wrong.
That's the goal.
Without drowning in a sea of medical jargon.
Exactly.
No one wants that. So whether you're here because you're dealing with something specific or you're just curious about how your body ticks, we're breaking it all down for you.
Right here.
Our main source, as I mentioned, is this big chapter from a textbook. So it covers the anatomy, which is basically the parts themselves, the physiology, so how those parts actually do their thing, and then common problems that can crop up, how doctors figure out what's going on, the meds they might prescribe.
That's all in there.
And even how nurses take care of folks with GU issues.
Yep.
So wherever you're coming from in terms of your background knowledge, we got you covered.
Absolutely.
Okay, so let's jump right in. When you get down to it, what's the GU system's main gig?
Well, fundamentally, the genitourinary system is all about filtering excess water and metabolic byproducts from your blood.
Okay.
And then kicking them out of your body.
So basically, it's the cleanup crew.
You can say that.
Keeping things tidy on the inside.
That's a good way to put it.
So who are the key players in this cleanup crew?
So you've got your kidneys.
Okay.
They're like your super efficient filters, constantly working to remove waste from your blood.
Gotcha.
Then you have the ureters, which are like little tubes that act as pipelines, carrying urine from the kidneys down to the bladder.
Okay, so they transport it.
Exactly.
All right.
Then the blotter, is the holding tank for the urine.
The bladder, yeah, we all know that one.
Yeah, and finally there's the urethra.
Okay.
The tube that carries urine from your bladder out of your body.
Right, when you go.
Exactly.
So it's a pretty neat system when you think about it.
Yeah.
Filters in the kidneys, transport via ureters, stored in the bladder, and released through the urethra.
That's it.
And that final release, that's what we call urination.
Yep. You might also hear it called micturition.
Micturition.
Or voiding.
Oh, yeah.
But it all means the same thing. Emptying your bladder.
Got it. Now, things don't always run perfectly.
Unfortunately.
What are some of the things that can mess with how well your GU system functions?
Oh, there are a ton of things, actually.
Yeah.
Age is a big one.
Okay.
As we get older, our muscles weaken and bladder capacity can change.
Right. Makes sense.
Then there's your medical history. Any conditions you already have, meds you're taking.
That can play a role.
For sure.
What about for women specifically?
Well, pregnancy.
With
all the hormonal changes.
Big changes.
And the physical changes, too, it definitely impacts the GU system.
Makes sense. What else is there?
Well, your lifestyle plays a role, too.
Okay.
Like how much you drink, what you eat, if you exercise, all that good stuff.
Gotcha.
And then certain neurological conditions can affect the nerves that control the bladder.
Interesting.
And your surgical history, especially any surgeries in your abdomen or pelvic area, that can be relevant.
Makes sense. Anything else?
Oh, and even exposure to certain substances at work or in the environment over time, that is, can impact your kidney function.
Wow. That's a lot to think about.
It is, yeah.
Can you give us like a concrete example of how one of these things might play out?
Sure.
Like, say, the medical history thing?
Okay, so let's take someone with diabetes, for example.
Okay.
If their blood sugar isn't well controlled, they're at a higher risk for UTIs. Urinary tract infections.
Okay.
This is because high blood sugar leads to more glucose in the urine. And that basically acts like a feast for bacteria, making it easier for them to multiply and cause an infection.
So even something like diabetes can affect your urinary health.
Exactly. It shows how interconnected things are.
Right. So now let's talk about some of the common problems that can happen with this system.
All right.
What are some of the, urinary elimination issues people run into?
So one we see a lot is urinary retention.
Okay.
That's when you can't fully empty your bladder.
Even when you feel like you need to go.
Right, even when you feel the urge. Then there's something called post-void residual.
Post-void residual.
PVR for short.
PVR.
This is the amount of urine left in your bladder after you've tried to pee.
Interesting.
And then, of course, there's urinary incontinence.
Incontinence.
Which is basically leaking urine unintentionally.
Yeah, we've all heard of that.
Yeah, it's pretty common.
I remember the chapter breaking that down into different types.
You did, yeah.
Can you remind us what those were?
Sure. So there's transient incontinence.
Okay.
Which is usually temporary.
Okay.
And it's often caused by a specific medical condition.
Right.
Or maybe a new medication.
Interesting.
Then you've got functional incontinence.
Functional.
That's when you have the urge to go.
Mm-hmm.
But something's stopping you from getting to the toilet in time.
Okay.
Maybe a physical disability.
Right.
Or a barrier in your environment.
Gotcha.
Then there's stress incontinence.
Stress incontinence.
This is when you leak urine during activities that put pressure on your belly.
Like what kind of activities?
Coughing, sneezing, laughing.
Oh, wow.
Things like that.
That's not ideal.
And then finally, there's urge incontinence.
Urge.
This one's a sudden, really intense urge to pee.
Oh.
So strong, it's tough to control, and it can lead to leakage.
So those are the main types of incontinence.
Yep, that covers them.
Okay, let's go back to urinary retention for a sec.
Sure.
What are some telltale signs that you might have that?
Well, you might feel a constant pressure or discomfort.
Okay.
Even pain in your lower abdomen. The area might be tender to the touch.
Mm-hmm.
Sometimes folks with retention get really restless.
Okay.
And might even sweat a lot.
Oh, wow.
But a major sign is if you're passing very little urine or none at all for several hours.
Even though you feel like you got to go.
Exactly, even though you feel the urge.
That's wild.
And here's a weird thing.
Yeah.
Sometimes the bladder can get so full that you actually experience overflow incontinence. Yeah. Where small amounts of urine leak out.
Because it's just too full.
Exactly. There's no more room.
That doesn't sound pleasant at all.
Not really, no.
All right, let's move on to another common problem that a lot of folks deal with.
Sure.
UTIs?
Oh, yeah, those.
Urinary tract infections?
Yep.
What's the main culprit behind those?
Bacteria, in most cases.
Okay.
And specifically, E. coli is often the troublemaker.
E. coli, that one pops up everywhere.
It does, doesn't it? It usually lives in your gut without causing any problems.
Right?
But if it gets into your urinary tract, that's when the trouble starts.
So what makes someone more likely to get a UTI?
A few things, actually.
Yeah.
Having an indwelling catheter.
Indwelling catheter, that's the tube that goes into the bladder.
Right, to drain urine.
Okay.
That's a big risk factor.
Makes sense. It's kind of a direct line in there.
Right.
All right.
Also, if you have urinary retention and the urine's just sitting in your bladder for a long time, that gives bacteria more time to multiply.
Makes sense.
Urinary or fecal incontinence can also increase the risk.
How so?
Well, it can introduce bacteria into the urinary tract.
I see.
And of course, not practicing good hygiene.
Down there.
Down there, yes. That can make it easier for bacteria to sneak into the urethra.
So hygiene is super important.
It really is.
Now, I remember the chapter mentioned a couple of specific types of UTIs.
It did.
What were those again?
So there's pyelonephritis.
Pyelonephritis.
That's when the infection spreads up to your kidneys.
So a more serious type?
Definitely more serious.
Okay.
And then there's CIUTI.
CIUTI.
Catheter-associated urinary tract infection.
Oh, right.
That's a common problem in hospitals.
In places like that.
Yeah, anywhere catheters are used.
Gotcha. So how would you know if you had a UTI?
Well, some common signs are dysuria.
Dysuria.
That's pain or burning when you pee.
Okay. Ouch.
Also, a sudden and strong urge to go.
That urgency thing.
Yeah, exactly.
Right.
And you might find yourself going more often than usual. Some people even experience incontinence for the first time.
Really?
Yep. And you might have discomfort or tenderness in your lower abdomen.
Okay.
Just above your pubic bone.
Gotcha.
And sometimes the urine itself looks cloudy.
Okay.
Or has a funky smell.
So those are all red flags to watch out for.
Definitely don't ignore those.
And probably see a doctor.
For sure.
Okay, let's switch gears to something else that can be super painful.
Oh, yeah.
Kidney stones.
Those are no fun.
Also called nephrolithiasis.
Right, the fancy medical term.
So what are they exactly?
Basically, they're hard, crystal-like deposits that can form in your kidneys.
All right.
Or anywhere else in your urinary tract.
Yikes. Just the thought of that makes me cringe.
Yeah, they can be pretty nasty.
So how do you know if you have one?
Well, the most common symptom, and this is often pretty dramatic,
Yeah.
is severe pain.
Okay.
Like really intense colicky pain.
Colicky pain.
Yeah, it comes in waves. Usually felt in your back or side below your ribs.
Oh, wow.
And it can radiate down into your lower abdomen and even your groin.
Ouch.
Sometimes kidney stones can also cause urinary retention.
How so?
If they get stuck and block the flow of urine.
Ah, so they're like a literal roadblock.
Exactly.
So what are some things that make you more susceptible to these things?
Well, not drinking enough fluids.
Okay.
Dehydration is a big risk factor.
Why is that?
Because when you're dehydrated, your urine gets more concentrated.
Okay.
Which makes it easier for those crystals to form.
So stay hydrated, people.
Absolutely. Also, a high sodium diet can increase your risk.
Ah, too much salt.
Right. And obesity is another factor that's been linked to kidney stones.
So watching your weight can help too.
It can, yeah.
Now, I remember the chapter had some advice for people who might be at risk for kidney stones.
It did, yes.
Can you remind us what that was?
So the main thing is to up your fluid intake.
Okay.
Like really make sure you're drinking enough.
Help flush things out.
Exactly. To dilute your urine and prevent new stones from forming.
Makes
It's also a good idea to avoid too much caffeine.
The coffee fiend in me is not happy about that.
Well, it's a diuretic, so it can actually make you dehydrated.
Right, which is the opposite of what we want.
Exactly.
Okay, good advice. Now, let's talk about something a little more serious.
Okay.
Renal failure.
Right, that's kidney failure.
So what's happening in the body when your kidneys start to fail?
Basically, they lose their ability to filter waste products and extra fluid from your blood.
Okay.
And that leads to a buildup of toxins, which is dangerous.
Yikes, that's not good.
Not good at all.
Now, the chapter made a distinction between acute and chronic renal failure.
It did, yeah.
What's the difference there?
So acute renal failure comes on suddenly.
Okay.
And sometimes it's reversible if it's caught and treated quickly.
So there's hope there.
Yes, definitely. Wait, but chronic?
Chronic renal failure develops more gradually.
Okay.
Over months or even years.
And is that reversible?
Unfortunately, no. It's usually irreversible. So what are some signs that your kidneys might not be doing their job properly?
Well, you might notice changes in how often you pee.
Okay.
Like a decrease in the amount of urine.
All right.
But sometimes, early on, you might actually pee more often.
Oh, interesting.
Yeah, that's kind of counterintuitive.
Yeah.
Other common symptoms are feeling tired all the time.
It's okay.
Nausea and swelling, especially in your legs, ankles, and feet.
That's edema, right?
Yes, edema.
And I remember seeing something about complications from renal failure.
Yes. As kidney function gets worse, some serious complications can arise.
Like what?
Well, there's metabolic acidosis.
Metabolic acidosis?
Yeah, that's when your body's acid-base balance gets thrown off.
Okay.
Then there's hyperkalemia.
Hyperkalemia.
Which means you have dangerously high potassium levels in your blood.
And that can affect your heart, right?
Exactly. It can be really serious.
Okay. Anything else?
And then there's anemia.
Anemia, that's low red blood cell count.
Yes, that's right.
And that makes you feel tired and weak.
Exactly.
So those are some serious consequences.
They are, yes.
All right, let's move on to something a bit different.
Okay.
Urinary diversion.
All right.
What is that exactly?
So it's basically a surgical procedure
to
create a new way for urine to leave your body.
Why would you need that?
Well, if the normal pathways are blocked or damaged somehow,
I see.
Usually they create an opening on your abdomen called a stoma.
Okay.
And urine gets diverted out through that.
So it bypasses the usual route.
Exactly.
Now, is that always a permanent thing?
Not necessarily.
Okay.
It can be temporary.
Like to give things time to heal.
Exactly. Like after surgery.
Makes sense.
Or it can be permanent.
Depending on the problem.
Right.
Now, the GU system doesn't stay the same throughout our lives, does it?
No, not at all.
I know the chapter talked about how growth and development affect things.
It did.
What were some of the key points there?
Well, for kids, there's nocturnal enuresis.
Nocturnal enuresis, that's bedwetting?
Yep, that's the one. It's pretty common.
Yeah.
And then pregnancy has a big impact on women's GU systems.
We talked about that earlier.
Yeah, all those hormonal shifts and the growing uterus putting pressure on the bladder.
Right, right.
And as we get older, well, we've talked about how aging can lead to changes in bladder function.
And continence issues.
Exactly.
So it's really important to consider these changes throughout life.
For sure.
Now, I know meds can also have a big impact on how we pee.
Oh, yeah.
What were some of the key types mentioned in the chapter?
Well, there are anticholinergics.
Anticholinergics.
Like oxybutynin and tolterodine.
Okay.
Those help relax the bladder muscles.
Okay.
So they're really helpful for people with urge incontinence.
Okay.
Or symptoms of an overactive bladder.
Like what kinds of symptoms?
Frequent urination.
Oh, okay.
And that sudden urge to go.
Right, that urgency we talked about.
Exactly.
So those meds kind of calm the bladder down.
You could say that.
All right, what else is there?
Then there are meds for BPH.
BPH.
Benign prostatic hyperplasia.
Right, the enlarged prostate thing.
Exactly.
So what do those meds do?
They can either shrink the prostate or relax the muscles around the bladder outlet.
To help urine flow better.
That's the goal.
Gotcha. What about pyridium?
Oh, yeah. Pyridium or phenazopyridine is the generic name.
That's a mouthful.
It is.
So what's that one for?
It's considered a urinary analgesic.
Analgesic, that means it relieves pain.
Exactly.
Oh.
It doesn't actually treat the root cause of the problem.
Like a bacterial infection, for example.
Right. But it helps with the pain, burning, and urgency that come with UTIs.
Oh, I see.
Or other conditions like radiation cystitis.
So it's more about symptom relief.
Exactly.
Rather than actually fixing the problem.
Right.
Good to know. So if someone is having issues with their GU system, how do healthcare professionals figure out what's going on?
Well, it all starts with a thorough assessment.
Okay.
They'll want to understand your self-care abilities.
Like, can you manage going to the bathroom on your own?
Exactly.
Okay.
They'll also look at your environment.
To see if anything there might be contributing to the problem.
Right.
Interesting.
And of course, they'll review your medical history.
Makes sense.
But specifically related to your GU health, they'll want to know about your usual voiding patterns.
Voiding patterns?
Yeah, how often you pee, how much you pee, if you have any trouble going.
Okay.
All that good stuff.
Right, that makes sense. And they'll be looking for specific symptoms too, right?
Absolutely.
Like what?
Well, there's a bunch of terms they use.
Oh, yeah.
Urgency is that sudden urge to pee.
We talked about that.
Dysuria is painful peeing.
Right.
Frequency is when you have to go more often than usual.
Okay.
Hesitancy is difficulty starting your stream.
Okay.
Polyuria is when you produce a lot of urine.
A lot?
Yeah, more than normal.
Okay, what about the opposite?
The opposite is oliguria. That's very little urine output.
Gotcha.
Then there's nocturia.
Not.
That's waking up at night to pee.
Ah.
Dribbling is when you leak small amounts.
Usually after you've finished going, right?
Exactly.
Okay.
Hematuria is blood in your urine.
Oh, that's scary.
It can be, yeah.
And we already talked about retention.
Right, the inability to empty your bladder.
So that's quite the vocabulary list.
It is, but it helps them be precise about the problem.
Makes sense. Now, I imagine they also take a good look at the urine itself.
Oh, yeah, the urine tells a lot.
Yeah.
They'll track your intake and output.
So how much you drink versus how much you pee out.
Exactly, to see if things are balanced.
Okay.
And the color,
okay,
the clarity, and even the smell of your urine can give them clues.
About your health.
Right.
Like if there's an infection or something.
Exactly.
So besides just looking at the urine, what other tests do they do to figure out what's going on with the GU system?
Well, a very common test is a urinalysis.
Urinalysis?
UA, for short.
UA, okay.
It's a simple test, but it can tell them a lot. Well, for accurate results, you need a clean catch midstream sample.
So they don't get bacteria from your skin in there?
Exactly.
Yeah. Okay.
A UA can detect things like leukocyte esterase.
Leukocyte esterase.
And nitrites.
Nitrates.
Which can be signs of a UTI.
Interesting.
Then there's a urine culture and sensitivity test.
Okay.
CNS.
CNS, right?
This one identifies the specific bacteria causing the infection.
Oh.
And helps them figure out which antibiotics will work best.
So that's important for treatment?
It is, yeah.
Now, for this test, it has to be collected in a sterile cup, right?
Yes, absolutely.
To prevent contamination.
Exactly.
Okay, what about those timed urine collections I remember reading about?
Oh, yeah. Timed urine specimens.
Oh, what are those for?
Like a 24-hour collection.
Yeah.
Those measure the total amount of certain substances in your urine.
Over a full day?
Right. A full 24 hours.
What kind of substances?
Things like protein or creatinine.
Okay, yeah.
And the chapter emphasized something important about 24-hour collections.
Oh, yeah.
What's that?
You have to pee and discard that first sample in the morning.
Okay.
And then collect everything else for the next 24 hours.
So don't forget to toss that first one.
Right. Otherwise, the results won't be accurate.
Gotcha. What other tests might they do?
Well, they can check your kidney function directly through blood tests.
Okay.
Those measure creatinine and BUN.
BUN. What's that stand for?
Blood urea nitrogen.
Okay.
And then there are imaging tests.
Like what?
Abdominal x-rays.
Okay.
Sometimes called KUB x-rays.
KUB?
Kidney, ureter, bladder.
Ah, right.
CT scans of the abdomen and pelvis.
Okay.
Those give more detailed images.
Gotcha.
Renal ultrasounds to visualize the kidneys.
Okay.
And cystoscopy.
Cystoscopy.
That's where they insert a thin tube with a camera into your urethra and bladder.
Oh, wow.
To see the inside of your lower urinary tract.
So lots of different ways to get a look at what's going on.
Yeah, they got a whole toolbox. Okay. Once they figured out the problem, how do nurses approach caring for people with GU issues?
So, based on the assessment, nurses use nursing diagnoses.
Nursing diagnoses.
Yeah, those describe the patient's health problems.
Like what kinds of things?
Well, related to the GU system,
yeah,
there are different types of incontinence.
Right.
Like functional overflow, reflex, stress, and urge incontinence.
Okay.
Then there's urinary tract infection,
Mm-hmm.
impaired self-toileting.
If someone needs help using the toilet.
Right.
All right.
Impaired skin integrity.
If incontinence is causing skin problems.
Exactly.
Right.
And urinary retention.
Gotcha. So that's how they label the problem.
Exactly.
And then what?
Then they develop a care plan.
Okay.
With specific goals.
All right.
The chapter talked about SMART goals.
SMART goals.
Specific, measurable, achievable, relevant, and time-bound.
Oh, right.
So the goals are really clear and focused.
So you can track progress.
Exactly.
All right. And what kind of interventions do they use for GU issues?
It really depends on the specific problem.
Okay.
For urinary retention, they might insert a Foley catheter to drain the bladder.
Okay.
For hospitalized patients with incontinence,
Yeah.
an external catheter might be an option.
Right.
Making sure people drink enough fluids is always important.
Hydration is key.
Absolutely.
Okay. What else?
Sometimes they recommend lifestyle changes.
Like what?
Avoiding bladder irritants like caffeine.
Ah, there it is again.
And cutting back on fluids close to bedtime.
To reduce those nighttime trips to the bathroom.
Exactly, to reduce nocturia.
Okay.
There's also bladder training.
Bladder training.
Yeah, to help improve bladder control.
Gotcha.
And for preventing UTIs.
Mm-hmm.
Education about good hygiene is key.
Like wiping front to back.
Yes, that's important.
Okay.
Wearing cotton underwear, showering regularly,
Okay.
and drinking plenty of fluids.
Right, we talked about that.
And just providing privacy for urination.
That's important too.
It is, yeah.
Anything else?
Oh, and pelvic floor exercises.
Those are the Kegel exercises, right?
Those are the ones.
Correct.
They help strengthen the muscles that support the bladder.
Gotcha.
And then just generally educating patients about lifestyle changes that can help their GU health.
So a lot of different approaches.
Yeah, it really varies depending on the individual.
And for specific problems like kidney stones, I imagine the interventions are more targeted. What would they do for those?
Well, increasing fluid intake is still key.
To help pass the stone.
Right.
And avoid caffeine.
Yep, that too.
And they'd also focus on pain management.
Of course.
And watching for any complications.
Absolutely.
Now, this chapter also had some really helpful questions and answers.
It did, yeah.
They really brought the information to life.
They did.
So let's run through a few of those
Okay.
just to make sure we've got this all straight.
Sounds good.
So the first one,